it is already written that what you are going to be.
Yeah.
And I think that's what is in your case. I think that's what.
Well, I guess, again, I know I don't believe that per se, but I feel, every random choices has a consequence. So I feel life is full of potential possibilities. You open a door and that takes you to one kind of a life, and you open another door that will take you to another kind of a life.
That's a wonderful
So
thought.
maybe, somewhere I opened right doors, and
What is the role of spine?
spine, I think, as rightly said, it's a backbone. You can't sit straight, you can't walk straight, you can't stand without the spine. See, during evolution, one thing which changed in human that made us different from monkeys or quadruped animals, is a peculiar shape of our spine. That shape developed over a period of thousands of years, and that shape has made us erect.
Okay.
That shape has made us walk.
Okay.
That shape has made us bipedal living beings. So I guess we are standing, we are differentiated from monkeys, we are differentiated from other quadruped animals. It's thanks to spine.
What goes in the surgeon's mind?
I feel there are two personalities of a surgeon. One is outside of theatre and one is inside. I think it's a chance to witness a surgeon operating inside operation theatre. Outside, he may be very docile, very calm, composed. Sometimes is too focused inside though. What changes is, I don't know. I mean, you can say a divine intervention or something. The moment you enter into OT, I think you forget everything.
In one of your articles, you have mentioned about faith in operation room.
Yeah.
Can you just elaborate? What is that thought?
Well, I guess, I think it's, you can say, a summary of so far whatever we have discussed, that, once you enter the OR, you feel that nothing is under your control.
Oh.
Why this patient had this disease, you don't know. Why this patient started trusting you, you don't know. Even if you will do your best, whether this patient will get the best outcome, you don't know. Right? So somewhere patient has put faith in you. You have put faith in science. And that faiths get connected. And that's how the world works.
Hello everyone. Welcome to another episode of Between the Lines. Medical science has gone far ahead in advancement, but still there are medical professionals and surgeons who operates and treats their patient not only medically, with philosophy, with wisdom, and utmost sincerity. When we talk about human anatomy, there are certain organs which are very critical for life, just like brain, heart, and lung. There is one more body part which is as critical as this organ, which is spine. Many times we say, this person is backbone of our family, is a backbone of his society. This is the backbone. Yes, the word backbone, spine is the backbone of our body structure. What is the role of spine? What can be the issue in spine? This all we will come to know in today's episode, as we are going to meet one of the well-known spine surgeons. He is a skilled doctor, he is a light-hearted person, he is a noble human being and having a rich philosophy, Dr. Niraj Vasavada. Dr. Niraj Vasavada carries over 2 decades of experience. Till now, he has already performed 9,000 spine surgery. He has worked in niche corporate hospitals. Presently, he is serving his service inside a hospital. He is a chairman of Online Education Committee, Asia Pacific Spine Society, a medical leader who drives his medical profession with rich philosophy. He mentors next generation through different forums, an author whose articles are published in a print media. So let's go meet Dr. Niraj Vasavada and enlighten ourselves. So Dr. Niraj, welcome to Between the Lines.
Thank you.
Information and knowledge is very easily available nowadays.
Yes.
And we keep on getting a lot of information, knowledge through a lot of resources. But what is required is wisdom.
Oh,
And that comes out of experience only.
Yes, very true.
And that is why Between the Line has, we have started Between the Lines. Because through Between the Lines, we keep on meeting eminent and experienced personality like you, keep on discussing about your journey and experience.
Okay.
And we get a lot of words of wisdom and a lot of insights. And that is why I think today you are here. We know that you are heavily occupied. You keep on doing a lot of surgeries, multiple surgeries in a day. Even today itself, you have come immediately after the surgery. So thank you for giving your time.
My pleasure. It's always good. I don't say that, sharing a wisdom is the right word for me. I think, what I believe very strongly is wisdom comes from bad experiences.
Okay.
Wisdom comes from, something which has happened which you did not want it to happen that way.
Okay.
And you realize later on that, maybe, I should have done something different to avoid that calamity, bad incidents, bad outcome. Probably that's the wisdom. So wisdom is you learn from your mistakes, your mishaps.
So you have rightly started with the word of wisdom, because realization is one very important aspects of life, which everybody doesn't understand, and that's what you rightly said. That's where the wisdom lies about. For all the doctors, when they are specialized in their faculty, I always have one curiosity that when you are into the medical study and when it is time to decide about specialization, there are a lot of different faculties. How to select, how you select the specific channel for your medical profession. So that is where I have this, curiosity for you. Spine, you have selected spine when you were into your medical study. And I'm sure, or maybe I assume that during that time, spine, the subject of spine was little bit of unexplored or little bit new. Then why spine?
Well, there is a long answer to this. I would say the commonest answer everybody would expect that I had a keen interest in spine surgery. I think, that's not my answer. It's a very orthodox, very awkward answer. I don't think that I ever planned my life.
Okay.
I still cannot understand that how a boy or a college-going kid can decide what he wants to do. Even today, I fail to understand if I want to take next step in my life. I really don't know, how to decide that part. So in those young years when, you are roaring with adrenaline, a lot of influences of youth which comes into play. So I don't think that, it was a very well thought decision. I have told in few other interviews also that my MBBS itself has been, accidental
is it?
choice. Yeah. I never wanted to be a doctor. But, circumstances, in a way, not sad circumstances, or it was ultimately my decision. My parents never forced me that, you should become so and so.
Okay.
Yeah, so you choose this, you don't choose that. So you can say that, it was a peer pressure which led me to this MBBS. And within 1 month, I realized that, I made a blunder of my life.
Oh, is it?
The biggest blunder of my life by
Okay.
choosing MBBS.
Okay.
I don't think that I am meant for this branch. If you see, probably I was somewhere, into a zone of depression that, in our days, if you feel that your branch is not right, there was no exit to it. So if I would have exited MBBS at that time, maybe, the only option was to do BSc.
Okay.
And might not have got into professional courses.
Okay.
So no option. So gradually realize that, I guess, when there is no option, you have to make your decision right. And that's how the journey began. So orthopedics, again, I got a very good score in my MBBS and the merit rank was also quite high. So was getting in almost all branches except, probably pediatrics, which was the most sought after branch in my time. So there is a very interesting story, how I chose what I chose. Somebody who is just completed MBBS and into top merit place, you are on cloud nine. You are quite arrogant that I aced this MBBS. And I went to one of my cousin. He's a very, very experienced oncologist, Dr. Chirag Desai.
Oh, okay.
You might know him.
Oh, yeah.
So I went to him and I asked him that I'll just, say in Gujarati so that, it carries the right meaning.
Right.
Chirag bhai, mane કઈ બ્રાન્ચમાં મારે લેવું જોઈએ. And he said that, what is your rank? I said, I'm getting 8th rank in MBBS out of 360 students.
Oh,
So he said, take MD Pharma.
okay.
I said, જીરકભાઈ મારો પાછળથી નથી, મારો આગળથી છે. In those days, pharmacy, MD Pharma
Yes,
was
true.
the least preferred
preferred, yes.
branch, because everybody wants to go for clinical branches. And he said that, I know that you are from the top 8, but still I'm suggesting that you go for MD Pharma. And I said, why? He said that, you mark my words, if you take MD Pharma, go abroad, do a good MBA, and you come back.
Okay.
Pharma industry in India is going to boom like anything.
That's true, actually.
And you might be sitting in the top management of one of the pharma companies. Today I realize that it might be a right advice. But I think, again, when you are into that zone of, top tier thing, you just go by, पहले कौन सी branch fill होती है, second कौन सी होती है. So in my days, top branches were pediatrics, radiology and orthopedics.
Okay.
So radiology, I was not much interested. Pediatrics, again, I thought I would not be able to handle small kids. It's very emotional things. So I don't think that I would. So only option was orthopedics. And I had, even during my UG, I was more fascinated by mechanics.
Okay.
So orthopedics is like mechanics. You are mechanical engineer for human body.
True.
So I think I am living my dream to be an engineer.
Wonderful, wonderful.
And then I think, my attitude from day one has been I wanted to stand out of the crowd.
Okay.
I wanted to be somebody who is an outlier.
Okay.
So orthopedics, when I took into that branch, I realized that there are hundreds of orthopedics. What is lacking? And spine popped out. And everybody discouraged me that, in those times, mat jao, result oriented nahi hai. Patients are never happy. Please don't opt for this branch. Then I thought, why not? Let me try with some. Nobody wants to do it.
Right.
And here I am sitting in front of you.
Wonderful, wonderful. I think it's a very, very interesting, that journey of, choosing the right stream. Somewhere you were not meant for that, or you were not intended, but ultimately you are into that.
Well, I guess, if, mythologically you speak, probably destiny brought me
Exactly.
here. I never planned, maybe destiny planned.
So one of our guests, who is a national badminton player, but somewhere he has this sort of, knowledge in his, area. So he shared that, when you born, it is already written that what you are going to be.
Yeah.
And I think that's what is in your case. I think that's what.
Well, I guess, again, I don't believe that per se, but I feel, every random choices has a consequence. So I feel life is full of potential possibilities. You open a door and that takes you to one kind of a life, and you open another door that will take you to another kind of a life.
That's a wonderful
So
thought.
maybe, somewhere I opened right doors, and here I am.
That's what we also feel, that, you have opened the right door, because ultimately everything is good for the patients.
Yeah.
Now, we all know about spine. If we ask anybody, they will say that it's a backbone of our body structure. But we want to know from the specialist, what is the role of spine?
Well, spine, I think, as rightly said, it's a backbone. You can't sit straight. You can't walk straight. You can't stand without the spine. See, during evolution, one thing which, changed in human that made us different from monkeys or quadruped animals, is a peculiar shape of our spine. That shape developed over a period of thousands of years. And, that shape has made us erect.
Okay.
That shape has made us walk.
Okay.
That shape has made us bipedal living beings. So I guess we are standing, we are differentiated from monkeys, we are differentiated from other quadruped animals. It's thanks to spine.
Oh, wonderful. Now, we all talk about our lifestyle, today's lifestyle, especially when we target the younger generation, because they are into the virtual world. So what is your word of advice or suggestions for younger generation to manage their spine?
Well, I guess, first of all, before we go to younger generation, I think we have to look into our own lives. I guess who made them exposed to this virtual world? I think somewhere we are responsible. I think, it's not a new thing if I advise that, if you want your children to stop going online or virtual, first you have to stop. And unfortunately or fortunately, world is so interconnected in today's time that it is impossible that you can ask them to stay away from this virtual world, or not go into other this online world or a dark world. Somewhere they will have to get exposed. But the thing is, they have to learn that they go into right kind of a thing. Second commonest question, even my parents ask me sometimes, તમે નાના હતા ત્યારે તમારે તો રમવા કરવાઈ જતા હતા, અત્યારના છોકરાઓ તો કોઈ બહાર જતા જ નથી. And I do ask question, where would they go? Have we left any space for them? Today, if you want to play cricket, you have to pay for box cricket and go in a net.
True.
We were playing so many sports in open field.
Open field, yes.
Right. Third thing, where is clean air? Am I comfortable sending my daughter's children in this polluted air around what we are living in? Right. So I guess, there are two aspects of this. We blame online culture. We blame our kids that, they are into home. But, we have not successful in providing them with an alternative where they can defocus from their online world and focus on something which is more meaningful.
Okay. But now, as we know that it has become part of life, and many times they use their mobile or tablet or laptop, maybe while either sleeping or keeping legs on the chair or somewhere. So if one point of advice if you can give us, because it may ultimately end up, putting the spine somewhere in the bad shape, or maybe some, they
I
may
think,
struggle.
controlling posture, again, I somewhere differ than conventional wisdom that, you have to maintain your posture.
Okay.
I feel, it is very difficult to keep on consciously maintaining your posture. If you do that, somewhere your brain itself will get fatigued.
Okay.
What you can do is you can keep your muscles strong.
Okay.
Right? If your muscles are strong, automatically body will be in a correct posture. So somewhere, body is trying to attain a comfortable posture wherein, it is at the least energy expenditure. So if your muscles are strong at rest, they more or less will maintain their posture. So I guess, everybody, not from only limited to children, even adults or, I would say geriatric people, they also have to imbibe a lifestyle where regular exercises are part of life.
Okay.
So if you focus on your strengthening of your muscles, somewhere, muscle will take care of your body.
Wonderful.
Having said that, yes, awkward postures should be avoided. Prolonged sitting, prolonged, looking at a screen at a shorter distance. All those things definitely, impact health of youngsters or even, at any age of time. So try to avoid those things. Be active, be mindful about, how long you are sitting on a screen. So mindfulness is something which you should be practicing.
Great advice, I think. Now, you are also chairman of Online Education Committee, Asia Pacific Spine Society. So really this online education helps, or what is the importance of online education, especially when we talk about medical and spine?
I think the online media or online medium has contributed immensely into this medical field, or more or less every technical or professional fields. If I go back and look my formative years when probably, I was trying to look for right training, there was nothing online available. I did not know where to learn, from whom to learn, and what to learn. We had to go to somebody who is, experienced, who is mentor, and, he will teach you that, this surgery or medical knowledge is practiced in a certain way. Today, I think everything is available online. You see, there are step-by-step surgical videos where, somebody has teaching you the nuances of this surgical techniques. Somebody is teaching you the philosophy behind that technique, how to treat patient, how to talk to patient, what is the protocol. Everything is available online. So today, say for example, one specialist sitting in Japan who is considered father figure, right? And I'll name it Professor Abumi. We have one webinar tomorrow. He will be on that webinar explaining his technique to put screws in the spine.
Wonderful.
And I think it is open for all.
Wonderful.
So in past, I would have to go personally to Japan to Professor Abumi at his time, taking time out of my schedule, go to him, learn and come back. Now, that can happen online without leaving comfort of my life.
That's wonderful. I think that means the knowledge from across the globe is accessible.
Yes.
Wonderful. Now, you are a surgeon. We many times we see on the screen on the movie, the operation theater scene. The doctor is ready with the apron and is ready to enter in the operation theater. I have a curiosity. You are a surgeon. You have a surgery. Maybe many times it's a very critical surgery. You have put on your apron and you're ready to enter into the operation theater. What goes in the surgeon's mind?
I feel there are two personalities of a surgeon. One is outside of theater and one is inside the theater. I think it's a chance to witness a surgeon operating inside operation theater. Outside, he may be very docile, very calm, composed. Sometimes is too focused inside the OT. What changes is, I don't know. I mean, you can say a divine intervention or something. The moment you enter into OT, I think you forget everything. In fact, it has happened to me multiple times that even if I'm struggling with some problem, some stress, some tension, the moment I enter the door of my OR, everything just goes in background. Only patient, what I'm going to do, remains focused. I think it starts from the moment I start entering into OT rooms. I start thinking about the patient. Okay, so-and-so patient I'm operating. So-and-so patient has this many problems. These are the MRI findings. These are the X-rays finding. My plan was this. I'm anticipating this problem. And gradually you come into that zone where, everything just fizzles out. And your focus is only your patient, and that too, the area where you are interested into. Sometimes, while operating, we forget about rest of the patient also. That, I am focused about doing this particular surgery and my focus is exclusively there. Minutes becomes hours and hours become sometimes days in some surgeries. And you don't realize. You only realize when your surgery is over. Oh my God, it's been 6 hours? No, it just blink of an eye. And
So that means I can say that a surgeon is already in the operation room before he enters into the operation room.
Yes, correct. I always say that a successful surgery happens twice. One in surgeon's mind, that is one day before the surgery.
Excellent.
And that plan getting executed in the OR, that yields a result.
But never, anytime you have experienced that some chaos is happening in the mind, or maybe you have planned something and last moment there are some sort of unplanned activity.
Lot of time. Your body is a miracle and everything is not under our control. See, one surgery which has taught me about is to expect unexpected. Right? I think very rarely it goes as planned. I think, you have to be very much prepared. It's like, you are very much interested in cricket. You don't know when the bouncer would come. Right? So you have to learn to defend. So I guess, you have to be prepared for all eventualities. And, there has to be a plan B. If this will happen, this I'll do. This will happen, this I'll do. Majority of the time, most of the surgeon has rehearsed that scenarios in their mind.
Okay.
I think once after a few years, I think it comes at very naturally to you, that because you have seen all kind of unexpected scenarios. Still, there are certain incidences where you have a blackout. Right? That you really don't know what to do. I mean, you are blank. It has happened to me in few of the cases where some very bad, unexpected thing happened out of the blue, and I'm just caught what to do. I think what I have found is, keep one thing in your mind, that the principle of do no harm. So when harm is inevitable, you have to try to minimize that.
Okay. That's a good concept.
And I think, that paradigm helps me to navigate through these difficult circumstances. What I have found that, sometimes when I get stuck in a surgery and I don't see that, what's the way around, I just, just push myself back a bit and just try to do other things, which is not related with that particular point, which is not letting me move forward. And I think, eventually it comes to you. Somewhere, you can say instinct, somewhere you can say experience, somewhere you can say wisdom.
Wonderful.
That, guides you away that, okay. And So far, touch wood, thank God, I never had to abandon a surgery so far.
Wonderful.
But I think, that can also happen.
Happen.
I mean, we have to be prepared for all eventuality. So I guess I would say that God has been kind to me, that, God always helps me out of a surgery. So I always say that, there are two person operating on you. One is a surgeon and the other one is God.
Wow, beautiful. Two beautiful point you have said, that expect unexpected, and second thing is when you feel that there is going to be harm, minimize the harm.
Yeah.
But does doctor believe in God?
Well, I think it's a person to person. God and faith is a very personal thing. So, in a sense that I think those who are into medicine somewhere, even if they don't expect or accept, I feel they believe in some superpower.
But so many times we as a patient or our family member is going to be in operation theater, we pray. So doctor also follow the praying or something sort of activity.
Oh, I think there are some doctors who would want to pray before entering a surgery.
Okay.
I would say that, my personal practice has been that, I always check that if my intentions are right for this patient. I think rest of the things God will
Wonderful.
take
Very
care.
nice.
So I don't pray per se, but, the only thing I ask myself before entering the room that hope I'm doing the right thing for this patient. And
Well
if the
said.
answer is yes, I think things
Well said. Well
fall
said.
in place.
Your articles are always very interesting and introspective. In one of your articles, you have mentioned about faith in operation room.
Yeah.
Can you just elaborate? What is that thought?
Well, I guess, I think you can say a summary of so far whatever we have discussed, that, once you enter the OR, you feel that nothing is under your control.
Oh.
Why this patient had this disease, you don't know.
Mm.
Why this patient started trusting you, you don't know.
Mm-hmm.
Even if you will do your best, whether this patient will get the best outcome, you don't know. Right? So somewhere patient has put faith in you. You have put faith in science. And that faiths get connected. And that's how the world works. So I always say that, if you are going on a road and somebody just touches you or holds your hand, you would feel like slapping him. Why the hell you are touching me? Here, a patient who was probably unknown to you 15 minutes, 20 minutes, half an hour before is submitting entire body
Yeah.
in a closed room
Yeah.
amongst unknown people. I think this is faith.
That's a beautiful definition of faith, I think. It's a very good interpretation of faith. So that means I feel that whenever you are in the OR, the faith is somewhere moving around in the entire room, maybe patient or a doctor.
Yeah.
Very well definition. Many times we take doctors and surgeons for granted in a way that, my relative is admitted now, is about to get operated. So I feel that doctor is a master of subject. He's going to do everything. So we take it for granted for a doctor that that is his job, he'll do. But what goes in the mind of the surgeon? Because many times you go into a very tough situation, critical case, going to a long hours surgery. So what doctors think or the surgeon thinks?
Well, I guess first and foremost, what I feel is a surgeon has to be very humble, very critical, and very honest about his capacities.
Okay.
If I don't audit myself, I think I am destined for a failure. So if a surgeon feels that, no, I cannot do this surgery, he has to be honest to himself, seek help. Because, I think today's time, getting expertise is not a problem. So first and foremost, again, I'll repeat that, the principle of any medical professional is primum non share.
Okay.
That's a Greek word meaning do no harm.
Okay.
So I think, every surgeon has to keep asking himself that, hope I am not doing any harm to this patient. If I cannot make this patient all right, that is okay. But hope I am not making him suffer more by my ignorance. I think, if that question is asked by everybody, more or less, I think you get the right way out of it.
So we can say that surgeon is on the job, everything is set, everything is programmed in his mind. At the same time, he's also blank, considering the surroundings. Or
Oh, yes, absolutely. Absolutely. I'm not sure what is going to happen. See, I mean, whenever I talk with a patient, patient's first question or the only question or only outcome patient wants is, will I be all right or not? And what I can say is that, this is what science says. That if science or an average surgeon operates 100 cases, this is the success rate of the surgeon. 5%, 6%, 7%, whatever it is, the failure of a particular procedure, that you have to understand. And I don't know whether you will be in those 7% or you will be in those 93 lucky one, where you will be a successful surgery. So I guess the experience, wisdom is something which takes you from maybe 90% to 93%.
okay.
But beyond that, somewhere you have to match the statistics. If world over a surgery has success rate of 93%, in your lifetime you will have 7% failures.
What is what is the acceptance of failure? Do surgeons accept the failures also, because they are masters of their subject?
I think yes, surgeons are very egoistic fellows, I would say. Some of the surgeons do feel very arrogant about also. But I feel, if a surgeon is not arrogant, a surgeon is not strong mentally, I think you would not want to trust your body with that surgeon. That is what I feel. But I think accepting a failure is part of our training. Accepting a failure is part of our life. So a surgeon who doesn't accept failures, I think, can never grow in life. If I don't learn from my failures, I'll not make my patients come out of that surgery successfully every time I operate. So I guess, you can never achieve 100%, but at least you should try to better your success rate more than what it is prevalent in today's time.
Okay. Every human being once in a lifetime experience fear, maybe in his professional life or personal life. Do you feel any sort of fear, or have you experienced any sort of fear?
Yes, I think fear is a very human emotion. I do get scared. I do get scared of complicated surgeries. I do get scared of so many things, I'm a normal human being. But one thing I've learned in my life, that the best thing which takes me out of these fearful situations is confidence on myself. I think, I have survived through a lot of storms. Some I can speak, some I cannot. But I think, those storms made me a better man, and I came out only because I had supreme confidence of myself. Joyu Jase, Ladi Leish. These two words are my mottos.
Wonderful.
That I'll manage.
Very nice. Amitabh Bachchan, even after spending 40, 50 years in his career, many times he says, even today when I go to set, I feel nervous.
Yes.
Do you feel nervous, or do you experience nervousness?
Yeah, I guess, nervousness again is a part of surgical practice. If it is a routine, very simple surgeries, we don't feel nervous at all. Over a period of time, that, the focus on that nervousness goes away. Somewhere maybe it is there in the background, but I don't feel those kind of, shaky legs or, shaky tremored hands or indecisiveness in my life. The moment I enter my OT, I think, something, enters into me, I get possessed, and I am never indecisive when I am operating. So yes, my surgical decision making, I feel, has been improved over a period of time, and I'm quite confident about that part. So I would back to differ with Shri Bachchan Saab. He's a very big man, but I think, beyond certain points, I don't feel nervous about my surgeries.
But is it true that when you feel nervousness, you become more cautious? So that's the sign of, you are alert, and the nervousness is going away, then slowly it will go away.
Well, I guess, if you have rehearsed these things, a surgery, a patient in your mind, somewhere you know what to expect. When you know what to expect, I think nervousness vanishes. So it's all about homework. If you suddenly go in an OT, which is unfamiliar, you don't know the people around you, you feel nervous. If you want to prove a point, you feel nervous. But if you don't want to prove a point, your only motive is that I want to make this patient as best as I can. I think, nervousness goes away. And that is why I think, if you see all surgeons, they prefer to operate in his own operation theater.
Oh, is it?
Yeah, because, I know the people. I know my assistant. I know my instruments. I know that if I'll need certain things, whether it is available in that OT or not. આપણે ગુજરાતીમાં કહેવત છે કે રસોઈ આપણા રસોડે જ સારી બને. So I guess, that is the comfort zone to minimize the nervousness. Bachchan Saab has to go to, different places, different location between amongst a lot of people. Maybe that is why he's saying that. So we want to operate same surgeries at the same place, even in the same OT, amongst same people, so that we don't feel nervous.
Correct. Now, you have already, done 8,000, 9,000 surgeries, spine surgeries. It's more than 2 decades of experience. What do you feel, what does spine teaches about life?
Oh, spine teaches about life so many things. One is strength. Right? If you don't have strength, you cannot survive. If you don't have flexibility, you cannot move.
Wow. Very
So
nice.
strength and flexibility, there's two things that spine teaches you. If you imbibe that in your life, I think, no matter what field you are, you will be successful.
But strength, in a way, is all about your mental strength.
Yes, mental strength. And at the same time, metaphorically, if you see, you can say physical strength also. If your body is not healthy, mind cannot function. If your mind is not healthy, your body cannot function.
So now, when you have touched upon the word strength, I'm still a little bit, eager to understand. You are under tremendous pressure as it's a very critical case. You are in this surgery. It is going on. And many times you spend hours and hours without taking any bio break also. So how do you manage to have that focus, without any sort of, break or without any sort of
I think, again,
intervention?
that's a body mechanism. The stress hormone, what we call as adrenaline, manages that part.
Okay.
I have experienced so many times in my life that if I'm operating a long surgery. See, for example, today, I started my surgery at 7 o'clock. The first drop of water was your coffee.
Oh my God. It's almost more than 10 hours.
So I think that was my first drop of water went down my mouth. That was your coffee. I feel, it's the hormone which keeps you going. There are surgeons who takes breaks. Nothing wrong in that. Somehow, my mindset is, I cannot somewhere tolerate if patient is opened up and I am just, taking a break and just relaxing. It's a huge responsibility on me. So some surgeons do, they take bio breaks. Somewhere I don't feel need to it because somewhere my physiology is adjusted to this kind of a thing. What happens actually is, you don't feel tired at all till the last step. The moment I remove my gloves, and sometimes if it is a long surgery, I no longer have strength even to stand. So I also ask myself that, what happened to that strength? Just a minute before, probably I could have gone for another few hours. And just the moment, that my job is done, my brain releases me out of the control and my body just collapses.
But do you follow any practice? Because keeping focus, so do you follow any specific practice to have?
I think,
it's a meditative state of mind, we can say.
No, I don't think, I follow any practice whatsoever. I think for me, which helps me is single most point that a patient has trusted me with his life and I want to do whatever best possible from my side. I think that gives me complete focus.
Excellent.
What if he or she is my father, my mother, my sister, my wife, my son?
Excellent. Very nice. So you have gone through a lot of different sort of cases, critical cases. Any specific incident or the surgery you can share which can be a different case of your life, or you may have learned something out of that? Or
I think every case is teaches you something. I think, I mean, everybody would want to talk about success stories. Yes, I have so many of success stories. Thank God again. Uh, and yes, I have my failures also. And I believe that, failures teaches you much more. I can narrate one incident, mm, usually, nobody likes to talk about his failures, but I think, I mean, this is the podium where I would want to narrate one case which taught me a lot of things, that there was one young child came from Africa, very crooked spine, very bad spine, operated by somebody else when that child was 4 5 years old. Now she is 12 13 years old, and she wanted to get it corrected. It was a hell of a challenging surgery. I think, she has gone to US, she has gone to UK. Everybody probably said that, this is a very complex surgery. If you undergo that surgery, be prepared to face very bad consequences. Child came to me with a mother, and we explained, we discussed for a very long span of time that, this things can go wrong, this thing can go right. I made them aware about all the possible complications. Even, death on table was one of the complications which we explained. Unfortunately, I mean, while I was operating, there was a moment when I felt that, okay, I mean, probably I climbed the summit, I think, which nobody could do. I could do that surgery. And in next moment, patient collapsed.
Oh.
We could revive the patient. We shifted to ICU. The child struggled, and ultimately we lost her. I guess, that patient has made a huge impact on my mind. I wouldn't say that I was not the right surgeon to operate. I would not say that, I was deficient in equipment to operate that patient. I would not say that, I had leg experience to operate. I've operated thousands of those kind of cases. What probably I did not do in that patient was to explain that mother, don't get operated. I explained all pros, cons, complications. I just carried away by the persistence of mother and child that I want this spine to get corrected. I feel, one of my job was to make them understand that, every spine cannot be corrected. It is bad, I understand, but accept it. Had I explained this in a more forceful way to that child, maybe she would have been alive today.
But I think your thought or your, intent was to make him walk, make him run. So
yeah, intent was right, but when I look back to that, I mean, I think one point, I think, that taught me that, this is something which is also my job to tell the patient when they should not do so. Long back, I think I would say around 10, 12 years back, this happened.
So same, whatever you have shared, in the same context, I have one more point that patient has come to you and you have checked him, and then you realize out of your technical expertise and the knowledge that nothing can happen here. He has to live with his pain. Nothing can be done. How do you manage this patient? Because you will have to ultimately convey that you will have to go with the pain, and you will have to live with the pain entire life.
There are some incidences where a surgeon or a doctor has to learn detachment also. I had been a very emotional person, and I'm even still very emotional. That was one of the reasons why I did not wanted to pursue medicine, because bad outcomes is something which you really cannot control. So yes, I think every surgeon has to learn detachment. My job as a doctor to make them aware about what is right, what is wrong, what is the right way to move forward, whether science can help them or not. I think at that point of time, I have seen patients crying. I have seen patient getting disappointed. I have received patient coming from US. I have seen patient coming from Africa with lots and lots of hope that, I mean, sir, you probably made so-and-so patient all right. Now, please do it that same for my relative. And unfortunately, I have to say that, nothing can be done. And वो जो मायूसी दिखती है उनकी आंखों में, that hurts you, you know. But I think we have learned to overcome that, you know, and we
So I
have to
think
detach ourselves
I
from
think that is also one learning which narrates that detachment at times detachment is also required.
Yeah.
So it's about your profession, but in life also somewhere detachment is required.
Very true. Very true.
That's very nice. Your articles keeps on getting published into the lot of print medias, and somewhere the author is somewhere inside in the surgeon, and we came to know that you are also writing your book. So you have started some steps to write your book. Would like to know about that.
I think life has taught me so many things. You know, I have seen quite a few ups and downs. Some downs were my own making, wrong decisions, wrong choices, and some downs were despite right decisions. And ups has been always celebratory. So I guess, I just am penning down what I have gone through. I'm not sure whether I'll be able to publish it someday or not. Yes, it's a work in progress, but I'm still not committed that I'll publish a book. But definitely, I am collecting my experiences, maybe for my future generation, my son, my daughter. My son is on my path to become a doctor. So I thought this is the best legacy I can leave behind for him whenever I depart from this world. These were my experiences, and if you can learn from this something.
I would definitely urge you to publish this book, because as a surgeon, you treat patients. But apart from patient, there are other audience, as you say, that you want to put legacy behind. So I would request that legacy should not be limited to your family. It should go to people like us, the younger generation, next generation, who go through your these experiences and learn. Because ultimately, the kind of book you are penning down, I feel it will be a inspiration for the next generation, a learning from the next generation. And I'm sure a lot of surgeons are coming up in near future.
I
They'll
guess
learn.
I have learned a lot about life. I now look this my profession very philosophically, and I think I'm trying to correct those wrong things which I did. I'm trying to be a better man than what I was. So from today onwards, or since many years, my fight has been only with me. I try to better myself what I was yesterday.
Wonderful, wonderful. I really feel that today I'm meeting two person, a surgeon having that philosophical side. So I'm talking to two person today, and I feel that somewhere the 9,000 surgeries you have performed, it's not in the medical way, but I'm sure that sort of philosophy has
I
played a
think
major role in
every
getting the
patient
patient
is
out of that,
different. Every patient
table.
is different. Every patient has taught me something. Some patient may not have been happy with me. Some patient is very happy with me. But at least, one thing I know that, I did whatever I could.
Excellent. Last point, our younger generation needs a lot of guidance and wisdom, I'm sure. Out of your experience, maybe a success, failure, a lot of surgeries, please give your words of wisdom and advice to our younger generation.
I think I'll come back to that one aspect only, that, learn and make yourself so strong in whatever field you are that you are not dependent on anybody. Have confidence, have faith, and just be honest to yourself. If you are honest to yourself, rest of the things automatically turns out. I would want to narrate a poem, which my father has taught me when I was a child. It's by William Wordsworth Longfellow. It says that heights by great man, reached and kept, were not attained by a sudden flight. But they, when their companions slept, were toiling hard at night.
Wonderful. Very nice thought.
So, I mean, this poem was always there in whatever studies I did, that was the front page note in all my books.
Wonderful.
It was taught by my father.
Very nice, very nice. And one more point, if you can just highlight the students or our futures who are opting medical and who want to be a doctors, if you can share something for them.
I think medical is a very, very sensitive branch. If you are not sensitive, if you are not emotional, I think this is not the branch for you. Initially, I thought that, since I'm emotional, this branch is not for me. But now I feel, if you are emotional, then only you should come to this branch. Because if you cannot feel pain of your patient, you cannot cure them.
Wonderful.
Don't come for money. Money is there in other branches, and much more money is there in other branches. But the satisfaction what you get in making change in someone's life, touching someone's life, is in no other branches.
Wonderful. This is a different level of advice you have given, and it's very practical. Dr. Niraj, once again, thank you.
Thank you.
After talking to you, I really feel that you very candidly share that you didn't want to go in the medical line. You didn't want to go in the spine faculty. But after talking to you, I really feel that it was not your decision, it was a God decision.
Yeah,
Because if you were not in the medical, I'm sure a lot of people might have, lost their chances of living this beautiful life. And it was a God decision that go and, do the needful to the people. And that's what you have been doing. So I feel that...
I guess I would disagree to you. If not me, somebody else would have done that. So I feel, at the end, I would want to say that, sometimes patient, those who are very happy, they come to me and they want to thank me. So I always tell them that, being all right was always in your destiny.
Oh, very nice.
So I am thankful that God gave that chance to me to make you. So that patient or those patients who are doing well after my treatment, they were already destined to be all right. So I am lucky that, I was one of the piece in that journey.
But that your intent works. That's very
I would
important.
want to believe so.
And lastly, Mr. Bachchan, during one of his shooting, he got hurt and he was on the deathbed and he was struggling with life. And then he got cured. He was in the Bangalore hospital and then he cured and he got back to his original routine and the action. In one of the event, he shared that when I was on deathbed, we had a choice to move out of India, to go to world's best hospital, or calling a world-based doctor in India to operate me. But we have decided that we will go with the Indian medical system. We will go with the Indian doctors because we had a faith on them. And that's what happened, that he was back. Today, after talking to you, I would reiterate this word that we have faith in Indian medical system and the doctors. And we will continue having faith in medical system and the doctors because ultimately, you are the one who keeps our life running. So once again, thank you for whatever you have done till now.
Before you end, I'm sorry to again, interrupt you, but, that's a very, very valid point. I think everybody should know. We always get attracted from foreign culture, foreign countries. That's okay. But, understand the population what we have. The doctors here, the kind of experience they have, a doctor sitting in US, doctor sitting in Germany can only dream about it. So the kind of experience, the kind of, you can say, getaway options what we have, I don't think, anybody in world that have. And I think finally my advice to everybody is, when I look at my life today, I think I have no regrets. I think that's the most important thing anybody should.
That's beautiful. I think we see a lot of positivity out of you, and that's what I think that is also helping your patients.
Thank you.
So once again, thank you for sharing a lot of insights and wisdom and giving your time. Thank you so much.
Thank you. Thank you.
That was Dr. Niraj Vasavada. Very insightful interaction. What we saw is a surgeon having rich philosophy, a different thought process, and has given excellent insights. The first point he has rightly touched upon is faith. Have faith in system, have faith in ourselves, and have faith in surroundings. There is a very thin line difference between faith and trust. Faith is all about belief, and trust is a confidence, action taken with the confidence, and then we have a trust on the people. So have trust and faith. He has wonderfully explained the role of spine, what spine teaches us. It teaches us to be a strong physically, mentally. It teaches us to be flexible in life. And third and very important point, have balance. Have balance in life and have focus. That's an excellent insight shared by Dr. Niraj Vasavada. And so I do have faith and trust on you as you have shown your excellent support to me. So once again, thank you everyone. And do not forget to read between the lines. Thank you.